Hello and welcome to the King Heroes Journey podcast. My name is Beth Martin. Super happy to be hosting Steve Goeddeke today, who is, I would say, an unusual chiropractor. And I think everyone that I know has had some kind of journey with their physical body, with their bones, with their spine and their alignment. I got my hand up for a whole bunch of that stuff, even that took me the better part of my lifetime, maybe all of it, to even realize what was going on despite seeing a bunch of practitioners. So I'm super excited to have this conversation today, especially since Steve is in the Love Your Liver cult, which is a complete joke. And actually, I would say this is absolutely not a cult. So I that's tongue in cheek all there. There's a lot of health cults out there, and this one is pretty amazing. One of my favorite things that Garrett Smith, who's the creator of Love Your Liver and Toxic Bile Paradigm, did in his live stream this week was to talk about how food is the most important thing, that, you know, no health guru is going to get rich doing that, telling you to take it in your own hands and just give your body what it needs in order to not be poisoned and not be deficient at the same time. So welcome everyone who's here. Hello, Accidental Alchemist and Anonymous Guest and Maya. Great to have you here. I see your question there. Definitely we'll get to it, an Anonymous Guest. And I think we'll get started. I just wanted to let you know a couple of things before we get full on. Is an event coming up in the House of, it's not actually in the House of Free Will, but it is including of the House of Free Will, which is my private association that anyone can apply to be part of. I do vet those members so that it's clearly a good relationship, that you're going to have some alignment, speaking of alignment, with the people that are already there and the values that we hold. It doesn't mean everyone needs to be identical, and that isn't even a good goal. It's not a possible goal, but just so we have enough in common and won't rub against each other unnecessarily. So I'm going to be hosting an open house for the coaching certification training that is coming up in September, starting with an orientation on September 10th. And training coaches has turned into my all-time favorite sport next to podcasting, which I really love as well. What both of those have in common is that it's allowed me to become a professional question asker. And that's the theme of this year's open house, that is free and open to anyone who signs up, is the power of questions, and how in a world where information has become extremely weaponized and there's a lot of confusion and people are turning their, hippocampus over to ChatGPT these days, this is an opportunity for you to see how to navigate and learn and gain mastery through questions, rather than getting out there and glomming on to some thing and just spreading the narrative that you could actually learn to think for yourself and have much better relationships and a much better chance at helping people. So that is coming up July 30th at 1:30 p.m. in the afternoon. And I'm going to drop a link here in the chat so that people can sign up. And if you have any questions about it, just let me know. All right, so without further ado, I am going to let you know a little bit about Steve Goeddeke, who's a chiropractor and innovator in manipulative therapy. That sounds a little dodgy too, but I know what you mean there. He's based in Granville, Michigan, and has developed original techniques and theories that advance the art and science of chiropractic care. Known for his precision and creativity, Steve helps patients to achieve lasting results and contributes fresh ideas to his profession. Over the past 3 years, Steve has begun an adventure into low vitamin A eating, which we'll talk about quite a lot, his journey on that, using it to successfully resolve multiple chronic conditions that began in his 20s, following attempts to eat healthy after experiencing firsthand the damage caused by following trendy dietary and supplement advice, which is absolutely rampant, especially in the health freedom movement. He's dug himself out of that hole and now shares his insights to help others navigate healthy choices more wisely. So bring Steve on. Hello, Steve. Welcome to the King Heroes Journey podcast. And can you hear me? Oh, can anyone hear me? Maybe, Steve, you have your sound off? Let's see. Can someone in the chat just let me know if you guys can hear me? I appear to be. My settings appear to be good. Hello, Steve. You can hear me? Good. Thank you, anonymous guest. And could you say something to see if we can hear you? Steve? He's not hearing me. All right. So give us a second to figure out what's going on. It seems you can't hear me.
There we go, Beth. I think I hear you now.
Okay. Okay, great. Okay, good. I wondered if that was it. And yeah, so good. Excellent. So you missed the intro, but that's okay. It was all about you.
Okay.
You know that part. And to speak on a piece of paper, that's good. I wanted to shout out, by the way, to anonymous guest, and I'm not going to get the names of the other folks who are helping to navigate my King Hero chat. It was nearly eaten alive by bots and spams and other kinds of infestations out there. Let's see, it's AU guest is another one, and then Madam M, who's just joined the chat there, although I haven't put her to work yet. So I just wanted to say thank you so much for your service. It has been amazing to get this chat back into a functioning place where I come on to post and respond to posts instead of just delete and block bots. So that helps me so much. I really appreciate it. All right. So Steve, I'm so glad to have you here. And I'm wondering, could you say a little bit about how you came into this journey in the first place? What attracted you to get into chiropractic work? And how did that journey go?
That's something that just kind of happened to me. I met someone when I was in my senior year of high school in the summer. I met a chiropractor who was working for the father of a friend of mine. And we started hanging out and lifting weights together and hanging out. And he got in my ear and he was very forceful. He said, "You're going to be a chiropractor." So I changed all my plans. I didn't really have the best plan. I was going to go study philosophy. Probably wouldn't have been a good career choice for me in hindsight. And he said, "You're going to be a chiropractor." So I changed my plans, went down to Atlanta, Georgia, 18 years old, moved all the way, 12 hours from home, and decided I'm going to be a chiropractor. And I started chiropractic school. It was over time that I learned that this was really what I was meant to do. It's really what matched my skills and talents. And over time, I just grew to love it more and more, got better and better at it, and just follow that spiral to just really enjoying what I do and getting really good at it and hopefully making some breakthroughs.
Nice. And you might have seen my post this morning just reflecting on how many people, is there any exception? I don't know if there's anyone who hasn't at some point gone to a chiropractor for some kind of physical pain, back pain, neck pain, whatever it is. And they end up getting, some people will say, addicted to the adjustments, that they have to, they get adjusted and then they end up having to get adjusted all the time. That, they'll be good for a couple of days or a couple of weeks, but everything will just kind of fall back into place. So that's one of the things I think that you've had a breakthrough with in being able to achieve lasting results. And one of the ways that I believe you've done that, from what I've gathered from your story already, is by becoming versed in toxic bile paradigm. Like you mentioned in your bio, going low vitamin A, which is really just a portion of toxic bile paradigm. It's bigger than that. People sometimes will label Garrett's work as low vitamin A, and it's really not the breadth of it by any stretch of the imagination. So do you want to talk about your Love Your Liver journey, where that started, what inspired you to work with Garrett?
Yeah, so I guess to start off, we can talk about my personal health journey. That's really what led me down this path to understand the toxic bile. And that's a little bit separate story from figuring out what's actually going on with chiropractic. What are we doing? But we'll get back to that later. But sort of the major things that happened for me is back in chiropractic college, me and my friends in school, we were doing all kinds of things that we thought were making us healthy. We were juicing carrots. We were going to the farmer's market, buying all kinds of colorful fruits and vegetables and greens and juicing them, eating boxes of mangoes and other colorful fruits. These are all high vitamin A foods. Back in school, I developed these really big problems. One is I got this really bad rash on the back of my hands, and it lasted for weeks and weeks and weeks. This happened probably about twice over my period of time in school, where I was embarrassed to even go to class. It was so bad. I didn't want to show my hands to people. I would get really bad flare-ups of sacroiliitis, which is a special kind of back pain. It's where your sacroiliac joint gets inflamed and it's unstable. And getting adjusted does not help this. I had my friends in school trying to help me with it, get me back moving, and nothing was working ever. So I didn't put two and two together why I got these problems. Of course, I'm thinking, gosh, I'm doing everything right. I'm doing all these amazing, healthful things. Why would I develop problems from that? It wasn't until later I started to put it together. Later on in my career, when I started my career, I was working at a pretty busy chiropractic practice, and we were recommending a lot of supplements to people. And so I was taking my own medicine. I was taking the vitamin D3 pills. I was taking fish oil, multivitamins. Then I got a little hobby farm in my backyard. I had a little plot that I was growing kale and spinach and tomatoes and things like that. At one point, I was drinking green smoothies every morning with kale and spinach, adding things to them like chlorella powder. Thought I was doing everything right. I should have been getting so healthy. But what actually happened was my health actually crashed around that time. My mood deteriorated. I lost physical strength. Even just bending over the adjusting table to adjust patients became agonizing. I was having almost kind of a anxiety mental breakdown where I couldn't handle the stress and the hours that I was working. I thought I was going to have to just quit. Around that time too, I was waking up. All of a sudden, I was waking up 3 or 4 times a night to go to the bathroom. So my kidneys, I guess, started to fail on me. I also developed this back problem where I was waking up at 4:30 in the morning every night. It's so stiff and uncomfortable that I couldn't get back to sleep. They have a name for this. It's called ankylosing spondylitis, and it's a really bad autoimmune issue. Basically, my back was trying to fuse up on me. So things got really hairy there for a while. That was I was 28, 29 years old. At that time, I was getting adjusted by the colleagues at my office, the people I was working with, probably getting adjusted 2-3 times a week. And I thought that was normal too, because that's what we were recommending to all our patients for months and months on end. But the relief was always temporary because it wasn't really the real cause. I went on a quest to try to fix my health. I consumed just tons of content, videos, podcasts, books, Twitter. I tried all kinds of things. I tried keto. I did carnivore for a whole year. I ate nothing but meat for a whole year. Of course, I kind of screwed it up because I was eating a lot of cheese and it wasn't very strict. I did the Weston A. Price Foundation diet, Ray Peat. I tried every supplement out there. I went down every little rabbit hole you could possibly go in. And that's the hard thing is for every idea out there, there's an influencer who will champion that idea. And their ideas sound so convincing all the time. And you get roped into them, and then you get so convinced this is the thing. And then it fails. It gets you nowhere. You're back at square one. One of the most harmful rabbit holes I went down was eating liver. You know, like you listen to the Liver King, and he doesn't look so good these days.
Mhm.
But after I got married to my wife in 2019, we started eating liver every week, probably about a pound each, so pretty big quantity. We were also trying to start having a family at that time. Now, I don't know if this is coincidence or not, but she had 3 miscarriages back to back to back. It was like one of the darkest, saddest times of my life. And this is right before COVID happened and all that, but it was just awful. Yeah. After we stopped eating the liver, all of a sudden, voila, we have babies that make it full term.
Amazing. Amazing. Congratulations.
Thank you. Yeah. So that got better, thankfully, by happenstance. I think we just maybe didn't like eating liver anymore, and we just stopped. But we also, I began to notice lingering joint pains, extra problems with my back, my neck, my shoulders, very bad anxiety, insomnia, sleeplessness. The eczema on my hands crept back in, and it became almost constant. Of course, the liver is massively, massively high in vitamin A. We were just poisoning ourselves. And there's acute poisoning and there's chronic poisoning. You can have acute effects like a miscarriage, but then you can have chronic effects that hang with you because all that vitamin A stores up in your liver, and you got to detox that over a long, long period of time. So the turning point was in 2022. I came across Dr. Garrett Smith on Twitter. And at first I argued with him and I fought him. And I thought, no, this is crazy. This can't be right. These are all healthful foods. You're talking about these things are poison.
Did he block you?
No, I think nowadays he probably would, but he was a little bit more lenient with blocking back in 2022. So I started following him. I read Grant Generu. I got into all that. I heard about his story. And at that point, everything clicked. It all made sense, and it all made sense why everything I did prior to that had failed. Because whatever I was doing, I was always eating these diets of like tons and tons of high retinol or carotenoid foods. So that's when my recovery really started. Within months, I stopped having flare-ups of sacroiliitis, which I had become accustomed to those hitting every 2 or 3 months, basically messing my back up for weeks at a time, almost like where I couldn't walk. So that stopped like right away. I started to experience some like detox symptoms. I had never had headaches before, really. It was never a big problem for me. I started to get headaches regularly. Those faded over time. Those were little short-lived detox episodes. Now I don't get headaches pretty much ever.
Good.
My eczema began to clear up, at least initially. And then my need for adjustments, like 2 or 3 times a week, I noticed that over about 1.5 to 2 years, that started to go away. And it's interesting, one of the most chronic things I had was right-sided rib cage pain, which guess what's on the right side here? The liver. And I think I was having a lot of referred pain from that. But all that started to clear up. And so now I'm to the point where I just go for regular maintenance adjustments, which is about once a month. And I don't feel like I need it. It's just I go in because I know it's a good thing and I need to make sure I get checked. But we're out of that trap of the constant chronic need for adjustments.
Amazing.
So
amazing. Do you mind if I ask, how did you manage through the, like Grant General, who's been here for an interview, by the way, if anyone wants to search the past interviews, they can see that. It was very good. And he talks about detox setback, which is, Garrett says, is not quite accurate. But how did you make it through those periods? Because they can be in the shorter term of starting the Love Your Liver diet, a little bit alarming, or a little bit, I heard of somebody who had a all-out gallbladder attack, and it was very intense for, I think, a shorter time, not ongoing forever. But how did you manage that? Did you have enough of a foothold in the information that you knew what was happening and you could just stay the course? Or I'm just curious for other people's sake.
I really absorbed myself with the whole conversation of toxic bile theory. I listened to every live stream from Garrett that I could find. I was very well versed in what was going on, and I knew it was all normal and expected stuff. I don't know if we've totally solved what Grant calls the detox setback thing. Maybe there'll be some more things that we figure out over time. I mean, this is still really early days in all this. Even though Garrett's done so much. The detox symptoms I had, they made total sense to me. The biggest thing, I would get these crazy migraine headaches. And then I would notice that these would come every week or two, a really bad episode. But then over time, they got less and less and less. The other thing I think that I experienced would be every few months, I would get really itchy. And I would get sores on my body and stuff. And one time I even got a big sore right over my liver, like a big rash. It's crazy. This stuff, once you stop intaking it, it wants to flood out of you in every way it can. And in my case, I tend to have this stuff come out of my skin a lot. Which I'm what Garrett would call an undertype. I don't have body fat stores to buffer myself. So things have to leak out in all kinds of crazy places, like my skin. So
yeah, fellow under over here, by the way.
Yeah.
And it's a different ball of wax. Now every time I see somebody who's overweight, I'm like, oh, okay, you're actually lucky. You have a place to put that poison other than your liver. Because for us skinnier types, or like you said, it finds its way. I also have had, luckily not very severe skin stuff, but consistent, persistent, ongoing skin stuff, and some breakouts and things like that. So it's I can definitely relate to that. And is there anything more you wanted to say when I cut you off?
No, that's pretty much my story. I did start to, as I was going through all this and developing my understanding of the toxic bile theory and vitamin A toxicity, I started to ask my patients questions. And at my practice, I see probably in a year, 200 new patients. So I get a lot of conversations, a lot of things I get to ask people about, and I get to talk to them about. We don't do a lot with recommendations here in the office. I mostly do chiropractic, but if people are curious, I do have suggestions for them, and sometimes they take me up on them. But a lot of times I hear that people are taking multivitamins. I hear about their diets, and then I see the problems they're having. And I also see that when people have one autoimmune condition, they tend to have 5 autoimmune conditions. Because they're all running together, they're all coming from the same underlying problem, and it all relates to toxicities and subclinical liver problems. And
what does that mean, subclinical, by the way?
Subclinical, that means that no doctor is going to find it because they don't really show up very well on blood tests. For example, your liver enzymes. They typically don't raise until you're in severe, severe distress in your body, because the liver is kind of the last thing that's ever going to fail. Your kidneys will fail first. Your heart will fail first. The liver is this workhorse that keeps working for you until all of a sudden your body goes into severe distress and you croak really fast.
Exactly. I've seen that in a few family members where the very last vestige, practically on their deathbed, and then the liver is, becomes cancerous or whatever they say happened, and it's the end. Once the liver's done, you're done. So, yeah. it's it's kind of a crazy thing. I'd like to go back to what you said about, I think this is a very common experience in the natural health world, which I now, I'm making a claim that the natural health world is in fact more weaponized against us than the mainstream medical system is. Like my parents ate pretty good. They would have a good portion of the protein and maybe one vegetable, not like 60 vegetables. Like I would, try to, sorry for the sirens, it's going to cut us off a little bit. And then, I go vegetarian and I'm all high on myself and judging everybody who eats muscle meat or eats meat.
Yeah.
And although they fed us liver, that was a bad idea. Now that I remember, we did have liver as children and hated it, but we're forced to eat it. And then so no matter what I've learned in my life in the natural health world, and I've been through a heck of a journey. I was diagnosed at 29. Interesting timing. You were around the same age when things started to fall down for you as well. I was diagnosed with a stage 4 lymphoma, and it came to a full stop for me. So that's where I was already into the natural health thing to some degree, but of course got much deeper into it after that, and had to fight for my life for 3 years. But that idea that you're doing everything right, and some of that can even come down to programming, which is one of my specialties that I actually, it's something that I can help people to find in their unconscious, the unseen. When you talk about unseen health with the liver, programming is similar, that it can't be seen from the outside, except the results and the symptoms and the signs of it until you go in and you find it. So programming, when you want to do everything right, it can be that what I call the perfect program, that if you don't get it perfect, you're going to die.
Yeah.
And there's a certain, becomes this life-saving technique to get it all right. And then in the field where we're flooded with all of the wrong information, outright lies, or just misguided people propagating things that aren't true, this doing everything right is very, creates a great deal of inner conflict. Do you want to talk about what that was like for you to wake up to that it wasn't what you thought?
So it's hard, when you start getting to the natural health world, you go down lots of different rabbit holes, and every time you latch onto it, because that's the thing, and whoever's the person who's championing that method, they become your hero and you follow them. And it's not until you try it for a while and then you see that, okay, the results aren't there, that then you have to wake up from that, and you have to, it's almost like you're escaping a cult. It's very interesting. I've never been in a cult, but I did get into the sovereign citizen thing for a little bit.
That's a cult.
I think you've had some experience, because I heard some of your other podcasts. And yeah, you wake up from it, and it's very alarming that none of the things they say worked, because it sounded so good in theory. Well, the same thing with all kinds of different health things. And like I said earlier, for every idea out there, there's a champion for it, and you can get stuck into these things, and you have to be ready to move on when it doesn't work.
Exactly. And that's why I appreciate so much. Sorry, were you going to say more?
No, that's all.
Yeah. That's why I appreciate so much having the idea, the concept now, and the name of the concept of the duration paradox, because that's how the rabbit holes get you. If you didn't get some results with the supplement or the remedy or the thing, then it would be of no issue. You just move on. You wouldn't get stuck in that rabbit hole. But because many or most of those things have that duration paradox, they appear to work at the beginning and then they stop working. But you have to say work in parentheses in order to be accurate about this. Do you want to talk about that duration paradox a little bit for anyone who's not familiar with the concept?
Yeah, so duration paradox, that's where something that you start trying, whether it's a supplement or a diet, it has an initial big positive effect. And the theory of the duration paradox is because you can actually ingest some toxic things that will actually shut your liver detoxification processes down. Your bile production slows down, and you actually feel really good for a while. And then you get into the accumulation of higher levels of chronic toxicity because your toxins aren't going anywhere. The trash isn't getting taken out, and that's going to build up, it's going to back up, and you're going to get another problem down the line.
Exactly. And even if it's not the very same symptom, like it's not the same eczema or the same sinus infection or the same migraine, then that's tricky because you think, oh, I've got a new problem and I need a new remedy for that new problem. So that's one of the reasons I love toxic bile theory, is that it makes you stop chasing around those individual symptoms and like, oh, that now I'll just study skin, or I'll study sinuses, or the ears, or whatever it is that takes the beating.
Yeah, and when you finally get that right theory and the right practice, you just settle in, and little by little, all the little symptoms fade away. I kept a list on my phone of every major or minor symptom I ever had. And I watched over the 3 years I've done the low vitamin A, little by little, I just check them off a list, or I move them down from current to intermittent to rarely, and then completely resolved. And I've had so many things just fall off my list over a 3-year period. Now I'm to the point where I'm like, most of my problems are gone. This is crazy. I've never been here.
Congratulations. That's amazing. Yeah. It's funny to watch myself go through those periods, because when I'm not detoxing, I feel better than I felt my entire life. And it's
absolutely,
like, yeah, wow. I don't have
detox, waves, and they come over weeks, and your detox can pick up a little bit, and then it'll kind of crest out, and then it fades, and then you're feeling the best you've ever felt for like a week or two, and before you start a new wave. But over time, the waves get less and less severe. They go up, they don't go up as high, and the symptoms are less life altering, and eventually it becomes kind of just annoyance.
Right, compared to like a showstopper, or did take time off work situation. Yeah, exactly. Yeah, I've been able to manage through most all of it. I had a couple of big ones, one from traveling and putting myself under incredible stress in February. But yeah, it's a bit of a roller coaster, anonymous guest. True story. But staying the course. The beauty is that every time I adhere not to some belief or ideas about it, but the actual data that I'm receiving, and I prove to myself, when I went off all the supplements and foods like garlic and onions that I thought were protecting my immune system, and then even though immunity is now totally up for grabs, whatever the heck that means, and in terms of pathogens. By the way, are you in the no virus camp with Garrett and many others?
Yeah, it doesn't make any sense. I don't. When COVID hit, that was right when I started my practice. So like I purchased a practice from my old boss, 2019. My wife quit her job to work with me and run the office with me, and then 2020 hit and COVID, and we had about right away initially the first month or two of that, our visits went from like say 100 down to like 40. So we had major drop in volume. Everybody fell off. We were panicked. We thought the world was ending, and we thought this thing might be real. But then we stuck with it, and we said, we're not closing our doors. We're a brand new business. We're not really seeing the alarming stuff yet. People aren't dropping dead. So we're just going to stay open.
How did that go?
Well, we had about 2 bad months, and then everybody came back in. And even though they kept up the scaring on the media and everything like that, people came back in because they needed care. And then we got to witness that while all this scaremongering is going on, we're seeing in the real world, we're seeing 100 people or so come in and out of our office every week. And it's like nothing's happening. Nobody's dropping dead. Nobody's even getting sick, really. So what's really happening here? Like people aren't, we're not, I'm not, if virus theory was real, I would have had COVID every week because somebody would have come in every week that would have transmitted it to me and I would have gotten sick. But catching illness doesn't seem to work like that. It's a little bit different. There is something to it, and I don't know if it's like a bioresonance thing. It usually happens amongst my family. If somebody gets sick, I think what it is some type of acute detox episode. But we're all sort of bioresonating with each other because we're all under the same roof. So we all do it at the same time.
Yeah. It was fascinating in growing up in my family. So, the kids would get sick. My dad would get sick. My mom would never get sick because she said she couldn't get sick. Right? If she went down, everybody went down. And so she put that off until, then as a later adult, she got deathly ill and died young. So
wow.
that, you hear that where, people who say, I never get sick, it's not necessarily a good sign.
That's part of taking out the trash.
Exactly. Yeah. Not the good way. And you can die of that. That's something, we people romanticize the detox process like, oh, it's so great. It's all spewing out my nose or whatever. And, but this is something that was a rude awakening to me, that there is actually harm caused when your bile busts out of the intrahepatic system and is in your blood and in your brain and in your skin, and it's damage.
Yes.
So that's got to be managed. And that's why in the Love Your Liver system, there are ways to, when necessary, in the case of, I don't think it's called an emergency, but there are times when you actively shut that detox down and turn to some of those methods that we thought were helping us.
And maybe it's just me. None of that stuff ever worked for me. I always just grin and bear it and get through it, and then it's over. I think I tried to slow my detox down enough times and just it didn't work. Probably it works for a lot of people. I'm a special case, probably. An undertype. I can't put on body fat. Go figure.
Yeah, maybe that's, I can be the same where I don't fit the norm in a lot of ways. And I had to shut the detox down just once. And it worked to a certain degree, but I could tell and it wasn't worth it. I just let myself go back to the process I was in because I wasn't in danger of it. Yeah. And then, the bioresonating, there is something we're in very close communication with everybody energetically. Right? You can sense it, you can feel it. You might not be able to name it or describe it. And it's very, convoluted and I want to say intervoluted. Is that a word? There's because there's so much going on within your own system, and then the communication, it's not super clear, but there is something about that we signal each other, just like other animals signal each other, and our own inner world signals itself, right? We're all about the signals.
And it's not terribly complex. You just think about when you're in a big group of people and say you're at a movie or you're watching a speaker, everyone coughs at the same time. Everyone clears their throat. Everyone yawns at the same time. What happens to one person? It's like a chain reaction. I've played some music myself. I've had a band back in my 20s, and we did a lot of improvisational stuff. And it's the same way. It's like things happen that you can't explain. Synchronicities happen that you can't explain. Exactly. Even if you're not that good at playing music, you can still do it. And our bodies do it, and we take information in from what's around us, and we're constantly working as almost like bees in a hive.
Yeah, actually, that reminds me. I'll just, before we get into a little bit more in depth with the chiropractic stuff, I use the term slipstreaming to describe how I can sing a song I've never heard before, especially with someone. It's not as much if I'm just hearing a recording, but say that person is right in front of me. I can sing that song. Even one very extreme example, I sang in Arabic right in front of a woman when we were on the beach in Mexico, and she just launches into this whole song. And next thing you know, I sing practically the entire thing with her. And after she's going, "Oh my goodness, I didn't know you knew Arabic." And I'm like, I don't. And
Wow.
I couldn't repeat anything, but I slipstreamed her exact patterning. And, so we have that. It is a superpower. So yeah, that was fun. So let's get into the bones and talk
Okay.
about the bones and the body and I've heard different things. Like, would you agree the bones are a crystalline structure?
Oh, absolutely. And the fascia. The fascia is the system that connects it all together. All the muscle, the bones, everything are connected through the fascia. And the fascia is very intricately related with the lymphatic system. So these things all sort of tie together. I guess a good way to start would be to explain my theory of what's actually happening when people get their spines adjusted. Chiropractors there's been some good work on this, and some good theories have come about. But I think that there hasn't been a lot of great work. And I think there's a lot that is not understood by most chiropractors. In my mind, there are three separate issues when people get adjusted that are commonly addressed. The first issue is kind of a very specific chiropractic issue where a bone actually shifts out of place. This actually doesn't happen throughout most of the spine. Most of the spinal joints, they lock in with each other very strongly, and there's not a lot of wiggle room. But you have some special considerations, some special anatomy in the upper cervical spine, up here, specifically where your skull sits on the first vertebra and where the second one sits on the third one, roughly. These are really, really important things, though. People will often have a car accident or a concussion or a fall at some point, a fall even on their butt where the force travels up.
Yeah.
And the force gets to the first failure point up here and it knocks something off in their neck. And these things will often sit there for years, even 5, 10, 15 years, and people will gradually develop problems. And it's rarely the pain is up here. Usually the pain will be somewhere else. Could be a shoulder, could be a hip. Because what happens when you have an upper neck, especially that like C2 bone, it gets knocked out of place and it sits funny. And there's this neurological effect that happens where you will see significant weakness show up. And I can test for this in the office by having somebody hold their arm out and feel how well they can lock their joint out as I push their hand down. I can do this with the leg too. Usually people that have this pattern, they'll have 1 weak arm, 1 weak leg. Usually it's the same side, but it can be opposite. That pattern sets up a compensation because we still do stuff and we don't notice that weakness because we compensate for it. We shift our spine, we shift our structure, we shift our movement patterns to an alternate pattern. And that pattern, initially, we're not going to notice problems from it. But it's like having a bad alignment in your car. Over time, your wheels are going to wear out, your tires will wear out faster, and your tires are all your joints and your ligaments and your muscles and your soft tissues. So that's going to come up really quick, or really slowly, rather. Almost every patient I come in that comes in to see me as a new patient has one of these upper neck problems because it just always ends up manifesting as some type of pain that tends to draw people in. When we fix this, we have immediate change, and it's like night and day. Whatever weakness we find will immediately go away in the arm, in the leg. Their movement patterns will immediately start to change, and within a few weeks, they're going to start to normalize, and typically most of their symptoms are going to start to go away. As long as you get that neck to sit right, that's the hardest part. Everything else is really easy. So that's kind of the first thing. The first big thing, that's a real chiropractic issue. The second one is that when you have these compensation patterns going on, when you're shifted off your normal structure, your body will start laying down extra calcium along the lines of stress to buttress you against the forces of gravity. That can set up adhesions, calcifications, stiffening of tissues all along the spine. And when that's been there for 5, 10, 15 years, there's a big role in like actually manipulating those tissues to release them. And that is also kind of like a one and done thing. And I find with over, like a 5 to 10 visit process with people, I can find most of those big things that are like snagged up for them and fix them wherever they are. And I have different ways that I can test for them and stuff like that.
I want to jump in my car right now and drive to Michigan.
So the third issue then, and this I think is the most common reason why what people are getting out of going to the chiropractor, is the most common maneuvers that people do, and actually most chiropractors do kind of the same adjustment to everybody. We call it the flying 7. There's about 7 maneuvers. You lay on one side, you lay on the other, you twist your back, one neck adjustment on each side. Sort of a generic adjustment. But what it does is, I think what it's doing, and I realized this from hearing the work of Perry Nicholson with the Big 6 lymphatic protocol. I don't know if you're familiar.
Yes, I do that.
It's really good. And me and my wife started doing it. We found like we could clear up stuff really quick. If we get a little stuffy in our noses, you just hit the first couple points, and within a minute or 2, it goes away. Then I realized that a lot of these adjustments that I'm doing with people,
Do it right now.
they're actually just lymphatic flushes. So then I figured out ways that I could really just target that and flush people's lymph as good as I possibly could. So now I realize when people come in, there are 3 separate things that I have to scan for. And I can tell right away, first thing I do is I test people's arm strength. And right away, that gives me an idea if they have the upper neck problem. Then I have some other tests things that can show up with a soft tissue adhesion or calcification or stiff tissues in the spine. That's another category of things. And then if none of that is showing up, then I know the person, if they're in pain, it's predominantly because they have a lymphatic backup. And these are the types of people that tend to come in sort of chronically. Lymphatic backup, my theory on that is that when people have lymphatic backups, it's probably due part and parcel to subclinical liver issues we talked about earlier, where there's, it could be like portal hypertension, there's changes in pressures, the liver itself is the receptacle of, or the source of about 1/3 of your lymphatic drainage. So your liver, if it's toxic, it's putting tons of stuff into your lymph, and that has to drain. And if you throw too much garbage into that lymphatic system, it's not going to drain very well, and it's going to get stuck in places. And so many people get stuck right up here, in the upper shoulders. You ever hear people say, I carry all my stress in my shoulders? They're typically backed up with their lymphatic system. So,
could I quickly ask a question? There's some confusion. Where does the lymph actually drain into? Is it into the blood? Because that's when you look it up in the literature, that's what it says.
So the lymphatic, it has sort of a complex flow throughout your body. If I remember right, one side of the body, like one quadrant gets drained, and then the other side, the other 3/4 get drained. But it all ends up coming here to the thoracic duct, I believe, and then it ends up back into your blood, and going to places like your liver to get processed and have those toxins dealt with.
Okay.
That's a good question. I actually don't know exactly where it drains into. I know the thoracic duct. I think it ends up back in the blood, though.
Okay. Very good. Yeah, I've got Julian Camastra, I believe is how you say his last name. He's a holistic dentist, and he's been studying. He's now studying the Love Your Liver work, and also asked me that question. That's what the literature said, that the lymph just drains into the blood, and he's like, that doesn't make any sense, because that's, like Garrett calls it, the sewage system of the body, right? So
Yeah,
it's kind of weird design how the sewer goes into the blood, but I guess that's the only way that it would get to the liver.
I think so. I think the thoracic duct, if I remember it, I thought it drains sort of around the heart somewhere, back into the bloodstream. I could be wrong.
Okay, no worries. If you find any different, let me know.
Yeah.
Yeah. And so, yeah, the bones, the fascia, and the lymphatic are all intimately tied. This is giving me some insights about the lymphoma that I had. And that's fascinating about the calcification. Now, we have a little bit of a calcium war. I was debating whether we should broach that subject. And, if you've done any, do you recommend taking calcium supplements to your chiropractic patients?
I've never done that in the past. I told Garrett that I didn't want to like get in front of his ability, his chance to be the first one to talk about that issue,
Sure,
this
we'll
issue
leave
of this
it.
live stream next week.
Yeah, we'll leave it. No problem.
Yeah, I don't think I've never recommended people take calcium. I think people have too much calcium stored up in their bodies. But the bigger, deeper issue is not how much calcium there is. You can get into extremities of that, but the bigger problem is people's vitamin A toxicity. And then if they're taking vitamin D, which a lot of people are taking pills, they're putting this stuff in all the dairy, which is the most common, easily available dairy source. So the big deal is about a third of people, based on liver biopsy data that we know, I'm sure you probably heard this from Garrett, about a third of the population in America is severely toxic with vitamin A in their liver, meaning they have so much vitamin A in their liver that they've had to accumulate that over a long time. It would take a very long time to detoxify. It's enough to cause major problems in the body. Vitamin A and vitamin D, like the calciferol, the ergocalciferol, cholecalciferol, both of these things, and especially in combination, you can almost think there's like a conspiracy theory with the milk, because they add the vitamin A and the vitamin D, which dysregulate the calcium, into the most readily available calcium source. It's almost like they don't want the calcium to go to the right places and do the right things. Yeah, so I think that's the bigger thing with the calcium. And most people have too much calcium getting laid down in soft tissues as a result. And this just plays right into the category 2 issues of people getting too stiff in their spines and getting soft tissue adhesions and calcifications. We're laying down too much calcium. It's turning into bone spurs and arthritis, and people's discs are calcifying and stuff like that.
Right, exactly. And could you talk a little bit more about the vitamin D3 scam that's out there, and how, we've been taught that that's a way to mitigate depression in the winter. That's, they're busy blocking the sun. Apparently there's a new deal and new chemicals coming down for reducing all the sunlight to save the earth. And so how does vitamin D3 directly affect the bones, and how did they manage to lie to us so blatantly around that?
Well, I was looking into this week, like how did they get the D3 into the milk in the beginning? Well, it goes back to the rickets studies, and I haven't done a lot of the digging on this, but I suspect that they got things wrong with the science for that.
Yeah, rickets is a protein thing, isn't it?
It's like bone deformities.
Right, but the cause of it being more protein deficiency is what I think Garrett's stream was saying. Maybe I got that wrong.
I think that's probably more in the right direction of the real cause versus being a vitamin D deficiency.
Right.
Yeah.
Right. Yeah. So then is vitamin D3 like a direct attack on the bones? Would you say
Well, it is rat poison. They use this. This is like I think stage 2 rat poison. If the first poison doesn't work and they can't take care of the problem, maybe they go to the second stage, which is cholecalciferol, the exact same thing that's in your D3 pills and your multivitamins and all that stuff. And it's pure poison, and it kills rats by putting too much calcium into their blood. So long story short, vitamin A and vitamin D3, especially when they're in combination, is you're getting bone, or you're getting calcium pulled out of your bone, and it's getting put into circulation, and it's getting put into soft tissues. So we're getting soft tissue calcification instead of getting the bone getting the calcium where we actually want it, which is in the bones.
Right, exactly. Yeah. All right, well, we'll leave that. I think we're waiting for that stream with Garrett to talk more about the calcium side of things. Now, osteoporosis is a very big problem. My grandmother suffered incredibly with that disease. As you age, people tend to fall and break a hip just because they fell. Their bones become so brittle. Do you want to talk about osteoporosis and what you think is the real cause of that?
Well, it's older people, and older people tend to have more time to accumulate toxins. A third of the population is toxic with vitamin A in their liver. So I'd surmise that older people, they have more of a problem with vitamin A. And so most of these people, once they get the diagnosis of osteoporosis or osteopenia, a lot of them start to take calcium. The results with that don't seem to be very good. And I think that's because, I mean, if you look at the studies, there's minor changes, and it's very hard to build bone back for these people. It's because the calcium's not able to get to the right place into the bone, because they're all vitamin A toxic, and they may be taking D3 pills and drinking milk, stuff like that. So.
Right. Yeah, it's crazy. And then, for those of us that I for some reason never fell for the supplementing of calcium, but I gorged on leafy green vegetables, which are high in, of course, vitamin A and calcium and polyphenols. And you also mentioned oxalates. Yeah, although I steered a little bit more away. Like I would never juice an oxalate. Somehow my tongue knew that was bad and wrong.
Very smart.
But I would cook them, so I somehow think that doesn't reduce any oxalates, just cooking.
Yeah, I think when I was doing spinach and kale smoothies, and I was alongside that, I was taking I didn't cover this earlier, but we were recommending in our practice that people would take 10,000 IUs of vitamin A a day, or vitamin D3 a day. And the wisdom at the time, the wisdom was, if you get sick, take like 20 of them, which was like 60,000, 100,000 IUs of vitamin D3. And that's what we were doing. And I was doing this myself. No wonder what happened to me happened, because basically my soft tissue's all calcified in my back, and I got this terrible back stiffness, this ankylosing spondylitis that I had. So yeah, it's really bad.
Yeah, really good to know. I'm very happy to have broken my juicing habit, and boy, that's a time saver. Many things in the Love Your Liver thing are a time saver. What about the scam of what is it? The omegas, the fats, and the bones. That's you talked about fish oil all being what? How did they make us believe that was going to be good for the bones? Same principles of vitamin D.
I've always heard that omega-3s, people, if they were concerned about heart disease, they would get on the omega-3s or the fish oils.
Okay, I thought they were bone related as well, but.
And I think with the fish oil, the thing is there's a lot of vitamin A in those fish oil capsules. It's just not on the label.
Yeah. Okay. Sorry, I thought there was something with the bones and the fish oil. And so, if I could ask you about a few things that I've experienced in my life, I discovered that I have a scoliosis, and I have in the past had chiropractors, look at my spine and gasp and throw their hands up. And I had someone say like, oh, this will be a forever fix, and I just left and never really went back. But it's true. Like I actually have extremely, even when I palpate the back of my spine, it like right away in the neck starts to veer off, and I've got this good thing. So what do you think? And this could be from birth. I don't have my last practitioners were asking me like, what severe accident have you been in? What, were you, do you ever have surgery? But I was never ever hospitalized from an accident. I was dropped on my head by a cousin. I have landed on my tailbone a few times as a kid, but like, could that actually cause scoliosis, or what do you think?
I think scoliosis is probably more of a nutritional thing than anything else. Maybe it's a zinc deficiency when you're growing up and developing. Maybe it's related to a toxicity. But ultimately, scoliosis is really not something to be massively concerned about. The normal human spine may not even be straight up and down, stacked up. It may be normal to have a slight list to your spine, almost like a preload, versus being exactly stacked up. Having scoliosis is never a curse to have back pain forever. And it doesn't require like hundreds of chiropractic visits. You don't need to force that spine to be up and down again. That's not actually going to help the person. And in fact, sometimes the sicker people are the ones that have these straight up and down spines.
Ah,
I have had patients that have had really, really severe scoliosis, like where it's so severe, you're feeling their back and you're going, gosh, where is their spine? I can't even find it.
oh,
And I've had people like that come in and they think they're cursed to always have pain. Well, it turns out they can get to be completely pain-free, and their spine didn't get straightened. It's just it functioned better and the muscles worked better, and they coordinated the body better so that the body could communicate correctly to move that body in the right way so it didn't generate pain.
oh, that's so hopeful. I love hearing that. It's been tricky because having seen different practitioners over the years, one of the things that got me back, because I was disillusioned by that world and really hadn't seen a body worker, even a massage therapist, because I'm pretty guarded about who I would let touch me. Not because I'm afraid of that, but it's just an energetic transmission, and sometimes you end up with like taking on their stuff, or I don't know if
Yeah,
you've experienced that from massage therapists, and you leave and you got to recover from what they put you through or whatever. So I'm very, very choosy about it. And then I went through, this was pre Love Your Liver. I went through a very bad flu, and I had been previously in that year, I had a digestive breakdown. Like, it was over. I hit my liver hit its limit, is what I know now. And it started dumping, and it was just like it was kind of the end of the world in that respect. And I managed to recover from it. Too bad I didn't have the Love Your Liver paradigm yet, but my body started to slowly recover. And then I got a flu after my birthday. I ate too much cake. I called it death by cake, and it was a very bad flu. And then after that, sorry for this long story, I lost mobility in my, what seems like shoulder, but it's not. It's like the deltoid is it locks up. Like, that's about as high as I can lift my arm, for example. And even doing a right turn, like, no, can't signal that on a bike. All kinds of physical limitations. Is that what you would consider frozen shoulder? Apparently a lot of women go through that in their menopause years.
Yeah, that sounds a bit like a frozen shoulder. I used to work on people for frozen shoulder back at my old job with my old boss, and we had patients with it. I haven't seen a lot of the cases like that recently, but from what I understand, a frozen shoulder is a little bit more of a viscerally related thing. It's like a whole body, probably some type of toxicity or something that's going wrong in the body. And it's usually a self-resolving thing. Like it tends to clear up over like a 3 to 6 month period. and all the movement comes back, even if you do nothing. But I'm sure there's lots of things you can do with manipulations or tissue work to try to get them better, faster, or more functional as it heals.
Right, right. Yeah, I do believe it was toxicity. Again, that flu, right? Like I had the major bile dump going on, and then it was immediate after that, and it's been ever since. Now it's some years. I'm into it for like 2.5 years of the same thing. A little bit of progress from different things, but yeah, that's exactly what my osteopath said, that they often just go away for no reason on their own. And then
I'm curious, was that on your right side or your left side?
my left.
Okay.
Yeah. Yeah. What would you say is the difference between the right and the left?
I'm not sure, but it's really interesting. Like 90% of people's problems, they tend to be on the right side of their body. And I've always thought that's, well, in the past few years, I realized that that's probably because the liver's on the right and yeah, everything settled on the right side of the body. So.
Right. Interesting. Yeah. So another way that I'm a little different from everyone all the time.
Regarding shoulders, though, there is a common thing that happens that causes people to have shoulder issues, and I haven't actually found that many chiropractors that even look at this the way I do. The upper rib cage, like right under your clavicle, the ribs kind of, they go all the way to the back. They attach in the front and the back, and I think because of the lymphatic drainage that happens down here, this area can get really stiff, and you need to actually break up any adhesions in the rib cage. And that has been like the big thing that has helped me get a lot of people better with shoulder issues. So it could be that too. It can also be a problem in the wrists. The wrists are also a major driver of shoulder problems. There are 9 little bones in the wrist. And if these guys start to calcify on each other or stiffen, it'll cause effective weakening of your shoulder, like almost like a reflexive weakening when you get into an extreme position, up or down. And you encounter those positions as you go about your day doing things, and it results in a chronic tension in the shoulder, and that can feed into the neck, and it can even pull the neck out of place. So.
Right. Interesting. Yeah, I was thinking about the mothering days, and no doubt you've seen yourself and your partner go through this. That my kid needed to be held for 2 years in a row. Yeah, exactly. And even with the sling and everything, so you got the baby okay ergonomically, but you've got the hot pot, or you've got the heavy door, or you've got I noticed how I was just muscling through all these things, and then all of a sudden my wrists started to like, whoa, dude, this is not going well. And even bearing weight on my right wrist anymore at a 90-degree angle, like, no, it's a no. Still injured 18 years later from those kind of things.
God.
Yeah.
You probably need to get your wrist adjusted.
Yeah. Like I said, I'll be right there. Oh my goodness. What do you think of people that are, say, the whole yoga movement? I was a yoga teacher for many years. I went to India several times and studied all of that. Do you think that things like yoga are assisting people? Yoga, somatics, what do there's Pilates, all of that kind of stuff. Do you think that's assisting them at the level of their spinal health?
Yeah, I think so. Yeah. I did some yoga back when I was in college. I liked it. It was good. I felt good afterwards and everything. More recently, I've done like some body movement stuff. I found Tim, I forget his name, Original Strength, and he has you do crawling and rolling and these like primal movements, and kind of like getting your left and right side to hook up with each other correctly, and your left arm to connect with your right leg, and vice versa. And it really like ties your body neurologically together, so you can move better. And I think yoga does a lot of those same things. It's really good.
That's awesome. Yeah. See, I had one chiropractor tell me that there was nothing I could do. Like it didn't matter how many hours I would lay over a bolster to open up the front of the body, or all of that kind of stuff, that they were convinced that none of that, and massage do anything, the yoga, the exercises. I kept saying, like, what should I be doing? And she'd be going like, I don't know, like, do this, she'd say. And God bless her. I love her, but it seemed so it put me a little bit into futility. Like, well, if all of that stuff is not really going to help me with my neck and the spinal alignment, which I'm now hearing is not really that big a deal, other than the other symptoms. Then, so you think all of that work on the soft tissue is valuable to the frame?
Pretty much everything out there has some value. It's not stuff that I don't do myself. I'm not an expert in those things, but one of the patterns I do see is that when people have, especially those upper neck problems, one of the things that creeps in is because the body's unstable, it actually kind of affects your balance and your ability to coordinate and move correctly. Your body starts to get worried that you're going to fall.
Mm-hmm.
And I think when your body's worried about falling, it tends to bring your weight forward into a hunching forward posture, and your shoulders cave forward with it. As when your center of gravity comes forward, a lot of things happen. And I guess the body figures if you're going to fall, it's better to fall forward than backward, because at least forward you can catch yourself with your arms. That's sort of my little theory on that. But yeah, everything will sort of round forward, and you see so many people with this rounded forward posture.
Yeah, exactly. Yeah, some days I'll lie down flat and my shoulders won't even hit the ground. I'm like, oh my goodness. Other days there seems to be more opening. I do actually have one of my clients and apprentices in the coaching world that she says she healed herself of her scoliosis through doing the deprogramming work, just by by finding out, and I don't think she was even really working on her spine, but it was a side effect, as if, happy side effect of finding the places that she was stuck with a variety of life issues and getting to the other side of it. Yeah, she had incredible results.
Yeah, I mean, I would believe that. I mean, back to the yoga and stuff, there's energy flows in the body, and I think maybe the thing with yoga is you're more like affecting the energy flows and things like that, more so than just the physical muscles and structure. But yeah, if your energy flows, if they're supposed to go a certain way and they get redirected, I could see how that could change your structure too.
Yeah, exactly. It's it's a multifaceted. That's one of my complaints about chiropractic or any other field, that we've become so compartmentalized. That's what I love about your work, that you've expanded to include a much broader definition of health and causation and all of that kind of thing. That's why I'm excited to talk to Julian about the teeth, because the teeth your mouth is a huge part of your physical health. In fact, the teeth are bones, right? Do you ever, if we just segue quickly around the teeth before I find a few more questions in the chat, do you ever adjust for, obviously, the face and the cranial bones, but the teeth are a different level of bones?
I pretty much just adjust the upper neck. I don't go too much higher than the atlas and occiput. I don't mess with cranial bones too much. I've never really dabbled in messing with the jaw. Usually tends to take care of itself when we adjust the upper cervical. Nice. And I've never touched anybody's teeth.
Okay, very good. Yeah, I'm just drilling for everything here. So anonymous guest was asking, you'd love to hear your take on adjusting the atlas bone. Some say it's a miracle. Others say the relief is only temporary and need subsequent treatments to experience relief. What's your take on that?
So what's interesting is that it can be temporary. If I found a couple of years ago, I figured this thing out where if I adjust somebody's upper neck, they might come back in over the first couple of weeks, and that I might have to adjust that every time. I might have to adjust that 5 or 6 times. I figured out the upper extremity connection, though. If there's instability in the upper extremity, oftentimes from one of those wrist problems I mentioned, or from one of those rib cage problems up here that I mentioned, that causes a reflexive action in the neck, and it pulls with the neck muscles to try to stabilize that unstable shoulder. That can just pull that neck right back out of place. Lately, in the last year or so, since I figured these things out, usually it's a one and done thing. I adjust somebody's upper neck, and we just fix as many possible things as we can right on their first visit. They might never have a recurrence of that, or it might take them 2 or 3 years, or something might have to happen to them before that comes back. That is a problem that resolves, and it doesn't become chronic. Well, the only people that become chronic are the ones that they have the more of the chronic type of presentation, the lymphatic backup, that kind of thing.
Right. Great answer. That's so hopeful. I love it. Yeah, Artis, you're very welcome from me and Steve, no doubt. Let's see, there was another question to ask. Why are we getting sick? Maybe this isn't for you. When our grandparents and minimal, this is worth addressing. It might not be directly related to the topic, but do you want to approach this one? I've heard Garrett talk about why we get sick when our grandparents and parents had minimal complications, which actually wasn't my experience. I mean, they all got chronic diseases, parents and grandparents. So.
Yeah, so it's like everybody's sick. It's just different sicknesses. But the older people, and Garrett would say this, like things weren't as toxic back then when they were growing up, so they had less time and less exposure to toxins throughout their life. So they didn't accumulate as much toxins in their liver, so they have less toxic burden overall. We all have problems, though. It seems the younger generations, they are probably the sickest generation, but I think that probably comes back to the fact that when I grew up, like just the difference since when I grew up, we got maybe 2 or 3 shots, jabs. Now it's like, I don't know, they're doing 75 or something crazy like that, 75 doses. These kids like don't stand a chance, and all these kids are chronically sick. And they're just getting different problems than what the boomers get.
Right. And then liver health is inherited, right? So if the damage that our grandparents did by eating a lot of, dairy and eggs and vegetables that are high vitamin A and all the other fat soluble toxins, then they passed on that weakness to.
It all comes through the mother. Yeah. And the dad can possibly contribute some DNA damage.
Right, exactly. To a point where, many babies are born with liver damage. They start out jaundiced, right, which is a clear sign of liver failure at some level.
Yeah.
Yeah.
And then like, look what they're putting all the pregnant women on. They're putting them on multivitamins with tons and tons of vitamin A.
Exactly.
And they're probably getting at least the RDA just from their diets, particularly if they're like health seeker, healthy eater people, eating their greens and their salads and their tomatoes and all that kind of stuff. So like, they're really just poisoning us from so many angles, and mothers are really poisoned.
Exactly. Yeah. Yeah. And then they get more poison and eat that placenta, which you should never do.
Oh God, my wife did that with our first one, and that we realized that was such a massive mistake.
Oh,
we would never do that again.
Oh, sorry to hear. Yeah, good to know. Let's see. Joe's on the left side of Michigan. You guys are closer than I am. And he asked a question as well. Have you experienced any experience with biofield tuning getting to the cause of back pain for past life traumas? That's a loaded question. I've had some success with clearing biofield of these past traumas. You got into biofield tuning at all?
I can't say I have any experience with that myself.
Okay.
No.
Yeah. I see it at a distance. I see people are getting good results. Shout out to Chance Garton, the host of Interverse, who's got very into that, and who's Eileen McCusick, I believe. It's her thing. I have, and someone also earlier mentioned on frequencies and the bones. Have you got into any of the impact on frequencies? Do you use any kind of frequency therapy on the bones?
I don't really do any therapies at all. The only thing I do at my office is what I do with my own hands.
Right on.
That's,
Yeah.
I keep it really simple. And I can get really woo with what I think about, but as far as my practice is very not woo. It's very down to earth, physical.
Nice. I appreciate that. Sometimes also, have you ever had acupuncture where they put electrical nodes on the needles and then send a current? Do you have any opinion on whether that's a good thing to do or not?
I've had acupuncture before, but I've never had them electrically charge the needles. No.
Okay. Okay. Yeah. Yeah. I'm of two minds of that. Is that a good idea to send electricity through your body or not? So, um, and I'm curious, do you have any intention to train others in the way that you're working? It sounds like it's due to your innovation, not as common.
Well, you know what? That's a tough question. I did write a manual. I wrote a manual and it's like 60 pages or something. And I thought for a little bit that I would try to market this to other chiropractors and students. But my profession is kind of weird. There's not a lot of demand for this kind of thing. Most people, what they're looking for, because they've racked up $250,000 in student loans, or I don't know what it is now, 350 to get their degree. Most of them are looking to sell like a high ticket, expensive service. They're not looking to just do the work that I do and just do like a steady business of just helping people with simple things, low cost services. So there's not a tremendous amount of demand. In the future, I'm sure I will get into teaching though. I think there would be some changes coming up, and when that happens, I'll be ready to build.
Yeah, beautiful. That's awesome. I hope you do. Let's see. There was a couple of other questions. One was on this friend of mine has what an MD sister diagnosed him with facet joint sclerosis, and he believes it's a degenerative problem, and maybe wear and tear with prolonged toxicity that he's now remedying. He's gone love your liver. He thinks he might have an SI joint issue, which you talked about, sacroiliac joint. Say
Yep.
that? Yeah. Okay.
Sacroiliitis. Yeah. So facet joint sclerosis. That's your like run of the mill degenerative change in a joint. It's where the joint is getting extra bone laid down. And there's one reason that would happen. One is you got too much calcium floating around and it's trying to find place in your soft tissues to settle. And two, you have abnormal force loading in your spine, which is putting too much stress on a joint. When two bones, where they meet up, if there's extra pressure, more so than there should be, it creates this piezoelectric current, and it causes extra bone to be laid down there. So it makes the bone stronger where the stress is being put through it. This is like, I think they call this Wolff's Law. Bone lays down according to lines of stress. If the lines of stress are abnormal, then the bone gets laid down abnormally. So that's how facet joint sclerosis would develop. The other issue is sacroiliitis. Sacroiliitis is sort of a different type of thing. And sacroiliac joints, I don't mess with too much because sacroiliac joints are supposed to be very, very stable. When you have like an inflammation of that joint, it gets swollen and the joint separates and it can shift around. That is very painful. It doesn't feel good. And it doesn't feel good when you try to adjust that. And it doesn't help it. It doesn't make it better. It just aggravates the problem. Same thing with like a sacroiliac sprain. My wife actually had a bad one with our most recent baby. As the baby came out, it actually put so much stress on her sacroiliac joint from the pelvis expansion that she sprained her SI joint.
Oh,
and it's
wow.
taken it's kind of a 3 to 6 month healing process, really bad. And I never messed with her SI joint. I was adjusting her all through that to like maybe get some better movement above and below it, like when in the lumbar spine or with the hip joint. But I knew that I couldn't adjust her sacroiliac joint in a way that would fix that. And that's how it was for me when I had my sacroiliitis. It's like people would try to adjust it, and it would just make it way worse. And I would always be trying to avoid letting that joint pop or crack because it would always be a painful pop, and then it would hurt for a long time after that.
Right. So then in that case, is it just trying to rest it, trying to lay off it and give your
Rest
body
it. And there's some value too if you can get these belts that sort of like help to stabilize it. Maybe that helps. I'm not sure. It definitely puts the stress in a different place so that you don't feel it as bad. But yeah, it's just a thing. It's got to heal.
Got it. Yeah. I was thinking about pregnant women in general, how, your joints become quite elastic in that state, and you feel more flexible. And I think that's nature's way of just making that, the whole sacral area more expandable. And then some people also have that hyper flexibility that we think, oh, that's fantastic, you're so flexible, but that's actually a problem, is it not? That would heal over time.
It can be if you're really hyper flexible and your ligaments don't hold things very well. You're a little more susceptible to having something happen to you where you get an upper neck knocked out of place. Sometimes that extra flexibility can be associated with pain, and sometimes it's a problem and sometimes it's not. Sometimes that extra the pain is coming from something nearby. That area that's hyper flexible is hypo flexible or less flexible. So it's making that hyper flexible area move even more. And as soon as you fix the thing that's right next to it that moves too little, now it's all normalized. But generally, it's not a curse to have problems either. I mean, I have people with like Ehlers-Danlos syndrome, hyper flexible joints. Usually it's not a huge impediment to them getting better, although there's also a little crossover with those people with having chronic types of issues with lymphatics and stuff. So
Okay. And what about flexibility, where most people suffer a lack of flexibility? And is there more to it than they don't stretch enough?
Typically, like I don't really have patients do too much stretching because sometimes people actually get themselves into trouble with stretching more so than it helps. I think that comes down to people have too much calcium in their blood typically, and it tends to settle in soft tissues and make them stiffer than they should be. That's more of the issue than like people have a deficiency of stretching.
Okay, well, that's good to know. Yeah, sometimes, especially having been through a lot of yoga in my past, there was all kinds of things I backed off on because they caused problems, right? Like if I overstretch forward, then I end up with lower back pain, which I never have otherwise. So
yeah, that can happen. Yeah,
can't be right. And I mean, it's classic also because we're always forward. And, is it true that the front of the body shortens, the back of the body over lengthens, and we have to compensate?
Could be the pattern. Yeah, that's part of like when your center of gravity comes forward, the front contractures, the back becomes too lax, and you actually get atrophy of your back muscles. You lose athleticism, you lose the ability to move your joints because they need to have those back muscles activate.
Yeah, very good. All right. Well, was there any other subjects that you wanted to talk about also in the chat? If you guys have any other questions, I'm happy to field them right now before we start to wrap up. Anything else you wanted to share, Steve, about how people could work with you? What's the best way to take you up on?
Well, anybody, I know this is like to a wide audience on the internet. I have kind of a local, I tend to help people within 5 or 10 miles of me. I'm happy to see people if they want to travel to me or whatever like that. One thing I wanted to bring up is like, how do people find a good chiropractor?
Excellent.
That's a very hard question. I think you can do pretty good with an upper cervical chiropractor. There are chiropractors that do these specialized techniques that they really look at the upper cervical spine only, and those can be really good. Of course, they're not going to do typically like full body adjustments. They're not going to do the whole picture, kind of like what I've talked about here. But if you can at least get your upper neck taken care of, that's most of the problem that can actually be fixed. If you can just get that one monkey off your back, that'll be a big thing. Another thing to look for with chiropractic offices is, like, don't go to an office that has a full-time marketing person, because they're probably going to be like trying to sign you up for 60 visits, and you'll probably spin your wheels for a long time with them, and it's probably going to cost you like way too much money. Find an office that maybe doesn't do a lot of marketing, maybe somebody that has a local reputation, or you can get a referral from a friend or family member. Just somebody that seems like to have a reputation of being having good hands and taking care of people. That's what I would recommend.
Okay, fantastic. What's your take on, like, there's a few different strains of, say, of chiropractic. Like, there's network chiropractic where they come and they touch you and then they walk away for half an hour, and then they come and they touch you one more time. And like, do you think there's any efficacy in that? Some people like literally swore by it, and I'm like, couldn't see any results.
So people that I respect highly, they respect Donnie Epstein very highly, and he's the developer of the network stuff. I did see him perform kind of back in school. He did some live demonstration, and it was pretty interesting what went on. And I saw somebody on this table. He'd do these light, gentle contacts with them, and they would twist and contort and do all kinds of things. It was almost like they were like somebody speaking in tongues. I don't have deep experience with having that done to me, though. I don't know how, if it's doing the kind of stuff that if it's accomplishing the objectives that I accomplish. It's kind of like a whole different field almost. I don't know, but I'm sure they have people that get really good results with that.
They must. People wouldn't rave about it and that kind of thing. I just couldn't see it myself. Yeah, yeah. Also, I went to one chiropractor that would shoot me with a gun. You know those little impact things.
Yeah,
what they're called. Do you like that kind of a tool? You think that works?
The early part of my career, I worked in an office that mostly did that.
What's that called again?
Like a Pro Adjuster or like a Polestar. As soon as I got out on my own, I had one of those tappy guns. It's called an arthrostem. I still use it here and there for certain people, certain situations, like kids that are really apprehensive to getting adjusted, because I do work on kids too. And they go through a phase from like 1 to maybe 4 or 5 where they like won't let you touch them, but they'll let you do the tap on them. And a lot of times you can get things to happen with that. I have just found the manual adjustments, they just work way better and way faster, and it's just way more of a sure thing for me. So that's what I have to say about that. I did see people get the tap on their back, and people would just come like 30, 40, 50 times, and they wouldn't really progress. They'd kind of stall out. They'd get a little bit better, but it wasn't consistent. So
it was exactly that. Yeah, just like little things, and then it was like, what am I doing this for? So yeah. And Joe is asking, how can we introduce the low vitamin A message to local chiropractors? No pressure.
Oh, wow, that's a tough one, because I can't seem to get any of my colleagues really interested in this stuff. I'm sure it's going to be like there's going to be an adoption curve to it, though. I don't know if it necessarily like makes what we do in our offices more effective, but it does help to understand and explain why people are chronic the way they are, and put them into different categories in your head. I have tried a little bit to introduce like low vitamin A to patients, but it is a pretty big lifestyle change. Actually, most people can't change their diet. Cognitively, they just don't have the capacity to do that. So the interest level is pretty low, but I have had like a good handful of cases where people have taken me up on some changes, and they actually have progressed from chronic patient to coming every 3 or 4 weeks. So there some people do come along. They do accept it. So
Right, right. Yeah, I was saying in an interview with Garrett how our food choices are like our religious choices. And so yeah, suggesting to someone that the food that they have, held as sacred might be poisonous. It's a massive insult to their being.
yep, and people are like that with their supplements too. We get a lot of health seekers coming to a chiropractic office and people that want to take care of themselves. And a lot of times they have latched on to one of these theories or rabbit holes of nutrition and supplements. And I know that their supplements are they're damaging them. Maybe they're on a multivitamin. Sometimes they'll get off at a simple suggestion. Maybe they're not that invested in it, but some people are really invested in it, and you can't. It's almost like don't bring it up because it's only going to push the person further away.
Right. You have to meet them where they're at. And if they're not ready for massive things, then you either have to send them away or you have to just work with them where they can get.
And that's been like a big lesson for me, like not like because that applies not just to my patients in my office, that applies to like people in general. And it applies to all kinds of things that you could talk about. And sometimes it's best to just talk about simple things with people and not venture into like the heavy topics that are going to create division and separate you from your fellow man.
Right, right. Yeah, the beauty of helping people professionally, and I'm a huge fan of that as I talked about my coaching training, is that once somebody has hired you, a whole bunch of work has already been done on their end. They've realized they have a problem they're not getting past on their own or not getting past fast enough. There's a certain humbling which takes place where I don't know and I need greater information or more input. And then so they're less likely to go into resistance when you share with them. I also have a policy of asking permission. May I share with you, either a story that illustrates a transformation they could make, or the practitioner they could work with, or some other shift in their life. And that goes a long way too. That if they give you permission, if they say no, they say no. Okay, all right, good, we're good. But if they give you permission, then again, they've done a whole bunch of inner work just by saying, okay, yeah, lay it on me, whatever you got. Doesn't mean they're going to take your advice, but yeah,
That's a great policy. I like that.
it helps a lot. I don't like pushback and I don't like causing pushback, but I'm a born rebel. So I'm also not going to hold my tongue forever. And then I find being a professional helper is better than just always being vulnerable as a personal helper, which that can be frustrating when people just come and they want to tell you all their aches and their woes and their problems, and they really don't want to do anything about it.
Yeah.
Yeah. Yeah, very good. Joa said, I agree. You prefer manual adjustment any day over any device. You worked with a few chiros when you're RMT and hated it. When patients would sign up for a course of treatments when it's not needed, it's part of the plan. Yeah. I decided to do the plan just to try the plan in case the plan was right, but it didn't work. Yeah. There you go. It was nice. It's nice to have somebody, honestly, she would come in and in addition to shooting me with her gun, so, she'd lay her hand on me, not with any healing intention, but sometimes I felt like I got more benefit out of just the touch and the contact than any technique or anything that was going on there. Yeah. So, it's health is a quite interesting realm. It's much less mysterious to me now than it ever has been. And then I can't stress as well that the mental, emotional, spiritual components of it are foundational, because sometimes even if it's a structural thing that really is the answer, all of that inner work can get you to that place where you humble yourself and you find the right practitioner, you go down the right rabbit hole, you get guidance that otherwise, if there's too much interference and things going on here that you can't hear. That was one last question, if you don't mind, Steve, on osteopathy. What's your take on that profession? Do you have any opinion?
So osteopathy, a lot of them, some of them, I guess now adjust people still. They still do this. I don't know exactly how they look at it and what techniques they do, but I think DOs, Doctor of Osteopathy, I think most of them got brought under the wing of the medical system, and they mostly do like allopathic Western medicine. And maybe they do a little bit of adjusting here and there. Maybe they don't do any. They've been trying to do the same thing with the chiropractic profession. They've been trying to like offer like prescription drug rights and stuff like that. And it's they're just trying to like bring the profession under the wing of the medical system. But DOs have mostly already kind of got under the wing.
Okay, interesting. Yeah, I saw one who everybody said was miraculous and caused, so I saw him so many times, didn't get results. It was okay. I didn't dislike it. The experience itself was pleasurable. I saw a different osteopath who I consider to be actually more skilled. A similar thing though, in terms of results, and they would always say like, "Oh, I just that thing in your shoulder, I cleaned out the wound and now it's good." And it's like, no, it's not. Same,
Yeah, it doesn't really work like that. I mean, sometimes you get a one and done kind of thing you can fix, but it's always, you got to clear the whole pattern if you're going to fix something, and that's usually pretty complex. It's not usually something you do just right away in one visit.
Mm-hmm.
So.
Mm-hmm. Yeah, it's fascinating. The whole healing profession is fascinating because we've been running with our blinders on, not intentionally. We don't know, right? Like we just learned what we thought was information, but the whole thing is incredibly weaponized against us, as I mentioned. So.
Yeah.
All right. Well, thank you so much, Steve, for coming on today. I thoroughly enjoyed our conversation. And like I said, you might be seeing me. We'll see. Make it over to Michigan. We always love coming to the US for one reason or another.
All right. Come and stay at a hotel for a few days and get a couple treatments.
Exactly. Yeah. All right. Well, thanks for joining, everyone. Steve, people can find you at excelchiropractic.com if you're in that area or you'd like to travel, and we look forward to anything that you provide. You also are active on X, which is where you and I connected. I could share your handle there quickly if you like. Just see where there you are. And X is a really good community it's a good platform for the Love Your Liver Low Toxic Eating community. There you are, Dr. Steve Goeddeke.
It is, yeah. There's very few chiropractors on X. I haven't really encountered too many.
Right.
So I feel like when I talk about chiropractic, I'm sometimes journaling into the void, but that's okay. Develops my thoughts.
Yeah. No, I appreciate that. And because this should be talked about more. It's more important. It's part of the whole, it's the whole, right? You can't really just do parts. Parts don't work that well.
Right. And it even contributes to like toxicity. I mean, if you get your structure in better alignment, and better function, your lymphatics and your fascia tension is normalized, so your lymphatics move better. All that stuff happens better. So
exactly. That's beautiful. All right. Well, thank you very much. And if anybody is looking for the work that I do, you can visit me at bethmartins.com. It's going by in the ticker there. It's in the show notes below. If you appreciate the music that is in the intro and the extra, that's my son who goes by Psycho, Saiko on YouTube. I know this is not good, but he's 18. I can't do anything about that. And there are some links if you're interested in doing some of the deprogramming work and seeing how both working with archetypes to find patterns. I consider myself a detective or a pattern hunter, just like you and Garrett are. But with the inner life more so, then you can take me up on courses and personal coaching, and also coaching training, which is my big focus right now as we come up to our September date. August 6th is the deadline for the early bird on the coaching training. So if you're at all interested in becoming a coach yourself and learning to help people from the inside out, which this stuff really works, and it is, though it's the same slow cooking, long haul. It is not a quick fix, but this is a very sure transformation. I've seen a lot of miracles in my life and in other people's lives as well. Then you could take me up on joining the Journey Code Open House, where I'm going to talk about the power of questions. So you don't always have to corner yourself into making claims. You can learn and you can help people way better. I was just going to say how I noticed that when I go to Garrett's open house, not open house, office hours, same letters. Then when someone asks him a question, the first thing he does is ask questions. He doesn't just blurt out, "Oh, I'm the expert and I know that this is that and everything, is this or that." And the number of times he says, "I don't know," right? Like, to just be absolutely clear about what can be known and what can't be known and who is the expert. This is the part where I would come in to see yourself in that role of the observer and the witness of your own body, where we can override all the signals with ideas and beliefs and emotions, and then the programming that's invisible underneath all of that. So you can join the open house. It's coming up July 30th. It's absolutely free for anyone who signs up. There will be a recording coming out about it. And I'm also creating a special free gift called a question flipper. Actually, statement flipper is more accurate, where you learn how to take the things that you just want to blurt out and tell everybody, turn them into really good questions that can serve them and be much more satisfying and productive in your life as well. So that's that. Once again, thank you, Steve, for joining me. I appreciate you sharing all of your knowledge with us. And if you get to another place in your life and you want to share more, please absolutely call on us. I'd be happy to host you.
Thanks for having me, Beth. I appreciate it.
You are very welcome. All right, everyone, have a beautiful rest of your day. Bye for now, and we'll see you soon. What should I say? Actually, just wanted to let you know that coming up next week is Dr. Julian Castra on July 24th, 3:15 p.m., where we're all going to talk all about the teeth. And that's all for now. Okay, bye, everyone.